Welcome to medico nursing classes. So peritonsillar abscess. Peri means surrounding. Peritonsillar abscess we can also call it as quinsy. It is most important question. They may ask for 5 marks. And then so when it comes to the definition, it is a collection of pus in the peritonsillar space which lies between the capsule of tonsil and the superior constrictor muscle. So definition you can write, it is the collection of pus in the peritonsillar space. So this is the definition of the peritonsillar abscess. And then when it comes to the causes, usually occurs after the acute tonsillitis and then cryptomagna. Cryptomagna, it is the most common structure which is infected, and then pus culture shows growth of Streptococcus pyogenes, Staphylococcus aureus, and then anaerobic organisms. When it comes to the pathophysiology, due to etiological factor which leads to the tonsillitis. Tonsillitis means infection or inflammation of the tonsils, and then which leads to the tonsillar crypto get infected and sealed off, which leads to the intratonsillar abscess, and then which leads to the it burst into peritonsillar space through tonsillar capsule, which leads to the peritonsillitis, which leads to the peritonsillar abscess. So here tonsillitis, due to etiological factors, infection or inflammation of the tonsils may occur and tonsillar crypto will get infected, and then if pus formation is there, that will be rupture into the peritonsillar region, which leads to the peritonsillar abscess. This is the pathophysiology of the peritonsillar abscess. So let's see what are the clinical features or signs and symptoms of the peritonsillar abscess. There are mainly general symptoms and the local symptoms. In general symptoms, you can say that chills and rigors, and then body aches, headaches, nausea and constipation. And then in local symptoms like dysphagia. So dysphagia means difficulty in swallowing. And then adenophagia means painful swallowing will be there, and then hot potato voice, it means thick speech. And then trisms means difficulty in opening mouth. So these are all the some of the signs and symptoms of the peritonsillar abscess. So now let us move on to the diagnostic evaluation of the peritonsillar abscess. So in diagnostic evaluation, we need to take history collection, and then physical examination should be done, and then needle aspiration, CT scan, USG means ultrasonography, and then blood investigations. So these are all the diagnostic evaluations which is done for the peritonsillar abscess. So now let's see what are the treatment for the peritonsillar abscess. So at first, how we are going to treat the patient means hospitalization should be done, and then we need to give some of the general treatment like IV fluids, analgesics and antibiotics like paracetamol, and then oral hygiene should be maintained, and then incision and drainage of the abscess should be done, and then throat gargle should be done. So in surgical treatment, so tonsillectomy must be done which is having two types like interval tonsillectomy and the abscess tonsillectomy. So in interval tonsillectomy, it is done 6 weeks after the quinsy, and then abscess tonsillectomy, it means mainly performed in acute stage which leads to the severe bleeding may occur. These are all the treatment for the peritonsillar abscess. So let's see complications. What are the complications may occur who the patient is having peritonsillar abscess means, if patient is having peritonsillar abscess is not treated properly, it may lead to edema of larynx, and then parapharyngia. So edema of larynx, it causes obstruction of the airway, and then lung abscess may occur so due to aspiration of the pus, and then septicemia means